Okay, so we are talking about patients being involved in many steps in the healthcare system. As we heard from Anita this morning, here's an additional step, and that is involvement in health technology assessment. And I apologize to those who already listened yesterday to me. Some of the slides will be the same because health technology assessment doesn't change from one day to the other. The quick summary of the presentation is that patient involvement in HTAi happens worldwide, and there is a high variability how that happens, and there is room for improvement. But having said that, I will still go through my presentation. And afterwards, we will have a panel discussion with the people. If we have discovered an additional panel member, which is great. Yeah, let me ask before I start. Let me ask, who does not know what health technology is or what it is good for? Wow, good. Nobody dares to raise their hands. So who comes from a country which does not have health technology assessment formally? There are a few people from the African region, but otherwise you're all exposed to it. So let's. My name is Anke Holtorf. I'm the secretary of the board of HTAi. That is the association for people interested, the International Association for People Interested in Health Technology Assessment. And also, I've been for long years very active in the so-called patient and citizen involvement in HTAi interest group. The abbreviation PCIG is much easier to say, where we work together with many people interested in that. We have about 300 members over 40 countries, from HTAi bodies, from the patient organization side, from industry, the health technology developers, and other stakeholders. And with a purpose to promote and develop robust methodologies for incorporating the patient and citizen voice into health technology assessment, and thereby to strengthen health technology assessment. And a specific interest of myself, but also others, is to strengthen this in countries which currently don't have these kind of processes. So, what is health technology assessment? First, let me define what a health technology is. A health technology is any intervention that is used to deliver healthcare. So it could be a medicine, a medical device, a diagnostic, a procedure. That all falls under the name of health technology. And here is the kind of official definition of health technology assessment. Health technology assessment is a multidisciplinary process that uses explicit methods to determine the value of a health technology at different points in its life cycle. And what is really important here, the purpose is to inform decision-making in order to promote an equitable, efficient, and high-quality health system. So that is why it is important to you. It informs decision-making on whether you have access to therapies or not. And that is why you probably should be involved in these kind of assessments. The other highlight down there is in the small letters. The overall value may vary depending on the perspective taken, the stakeholders involved, and the decision context. Another reason why you should be involved. So how do we determine value in HTAi? We want to answer the question, how much more health do we get for the additional money we pay for this technology? And is it worth it? And to do this, we make a comparison of the clinical evidence we usually have from the randomized control trials, and then we do an economic assessment. And then we can say how much cost will we have for the additional value. But if we look in more detail, there's much more in the value. It's not only the clinical outcome, it's the safety, environmental aspects, perhaps legal aspects, organizational. How does it fit into the current pathways of care? And the wider implications for patient, relatives, caregivers, and population. And I come back to this sentence, the overall value may vary depending on the perspective taken, the stakeholders involved, and the decision context. Because it depends on your perspective, what kind of questions you ask, and what evidence you include in answering, trying to answer these questions, and then the value you determine. And that is why it is important that patients and others are involved in these processes. And we have a good situation because last year the WHO in the World Health Assembly released the resolution on participatory healthcare, social participation in healthcare as a mandatory thing to do over the next years for the member countries. So we want people to be involved in these processes because, as we heard this morning from the member of the parliament, if patients participate in policy making, we have better health policies. And HTAi and agencies increasingly involve patients in the HTAi processes because they have unique experiences and knowledge. As we just heard in the last session, they become experts in their diseases. They know how they live with the disease, how they live with the healthcare system, what kind of hurdles they face, and how to navigate the system. What better would mean to them, what is really the outcome that is desired by the patients, and what trade-offs they are willing to take. Do I really want to deal with these kind of side effects to have this kind of outcome? And they also know how different the patients are. We were hearing this morning about women and men differences. There are much more differences among the patient population, where patients are quite aware, or patient organizations are quite aware about these differences, and they may not be so visible in the doctor's office. Patient involvement in HTAi is two things. It's participation. That's the voice of the patients through different means of communication, attending meetings, doing a consultation, sometimes written submissions to the process, or giving feedback, receiving feedback. And then on the other side, there's research into patient aspects, which is, we discussed yesterday, patient experience data. How do we collect the data? This is what is the research into patient aspects, qualitative research, systematic reviews, patient preference studies. It's robust research which can inform and bring additional evidence into the decision processes. This is from a work I've done with my colleague Gianni Müller, and Lauren was involved in that too, where we looked in low and middle income countries, what are the rationales for patient involvement in HTAi. And as you can see, there are different types of rationales: scientific, instrumental, to have quality improvement in the decision and the decision process, because of the unique knowledge patients have, to have a better quality of the interpretation of the data that have been submitted. What do these results actually mean for the patients? And to reduce uncertainties in the interpretation. Then there are democratic reasons to involve patients. They have the right to participate in anything which is about them. Then there is the issue of accountability of the process versus the population, transparency, legitimacy. And then the third point is developmental. If you involve people into any types of decision, they are becoming part of the decision. And you probably have a much better acceptance and possibility to implement your decisions. This is kind of like symbolizing the process of HTAi, and patients can be involved along the entire process of HTAi. However, it's not always the same goal of involving them. At any step, there may be different goals, and it's important to be aware of these goals. Because only if you know the why are we involving patients, what is the purpose of it, can you say what kind of patient expert do we need? Do we need somebody who has the lived experience? Do we need somebody who knows the patient population? Do we need somebody who knows the whole healthcare system to be able to help us? And also, how do we involve them? It's like, do we do some research, or do we have interviews, or do we have them sitting on our committees? It depends on the questions you want to answer. So the objective of the involvement is always very important. And yeah, and I'm coming back to this picture I used previously with the elements of value. And I've resorted these elements. And now you see here on the right side, it's the same kind of things, but I've put them in order. And incidentally, this is exactly what health technology assessment in the European region looks like. This is basically what is required in the submission dossier. This is what the agencies look like. So there are clinical things, health problem, technical characteristics of the technology, safety, clinical effectiveness, and then there are more value-related things like cost and economic evaluation, ethical analysis, organizational aspects, social aspects, and legal aspects. And if you separate that, you have the new European process for health technology assessment. The first part, the joint clinical assessment, is the clinical aspects, and that is done across the countries collaboratively. And then they produce a report that is delivered to the member states, and in the member states, they will do the value part of the health technology assessment. And then you see there a stakeholder network. That is kind of an advisory board to the process to survey the processes, but we have some experts here, so I don't talk too much about that. That is where patients are participating on the organizational level in the EU processes. And then we have also participation in the actual assessments that are done, either on the EU level and ideally also on the national level, because on the national level, the decisions are about how do we implement these technologies in the national context. And that's where patients know best how they experience their healthcare system. Okay, here's my quick summary. Health technology assessment is broadly done, and we've seen that here, that the majority of people is from countries where health technology assessment exists. Patients can be involved in some or many aspects of health technology assessment, either through participation or through research or organizational involvement, like the stakeholder network. And patients are involved in many regions to various degrees. There's a high variability, but then there are still countries, as we also saw by some people raising their hands, where patients are not involved in HTAi. And in the EU, the last two slides, the process is split between a central cooperative level, the clinical parts, and then the value assessment level in the countries. Yeah, with that, I'd like to open the panel discussion and introduce the panel here. We have, on the left side, we have Valentina Stramiello from the European Patients Forum. And then next to her is Julie Sponi, the project officer for HTAi in the European Commission. Laurie is well known to everybody here. And then we have Lauren Pretorius, who just appeared out of the blue.
She has a calling to the HTAi cause.
Well, she gave a wonderful introduction to HTAi last year, and if you have the chance to listen to that via YouTube, I think that I would recommend it. Maybe as an introduction, if we do a quick round, starting from Valentina, why are you here? What is your experience with patient involvement in HTAi?
Okay, I will try to cut it short. Otherwise, my engagement on this topic started 10 years ago, so I cannot say anymore I'm a beginner. When I started, I didn't even understand the acronym of HTAi, but soon I got engaged with the HTAi International and the PCIG group, and at the same time I started working on a joint action, an initiative that was called UNETA, where the patient perspective was somehow considered in the processes and patient organizations were consulted. Then soon we moved to discussing whether there should be an HTAi framework on the European level, and that's how the work on the HTAi regulation started. On my side, I was the one advocating for patient involvement across countries in the European Union on behalf of all patients. So there were very few patients on the European level doing that, and I was one of those few. And that was, I think, an opportunity for me and a great honor, because of course it came with a responsibility, but I did my best to be an advocate for patient involvement in HTAi. Today, I'm still involved with the HTAi Stakeholder Network, which is the governance body that is consulted by the HTAi Secretariat and the Coordination Group. And my organization is somehow the one supporting the coordination effort of all patient organizations that are involved. We, as EPF, won't ever be invited to an assessment because we are non-disease specific and non-country specific. So there is no point for us to be directly involved in that sense, but we try to push and promote patient involvement, bring methods, and also advocate for better involvement and more meaningful involvement of patients in HTAi.
Thank you. Julie.
Thanks. I will also try to be short, but so as you said, I'm a project officer within the European Commission in the unit dealing with the implementation of the EU HTAi regulation. So basically, we're the secretariat to the member states' representative coordination group, and we provide administrative support to member states. We also provide support to the different actors involved in the process. And one of the main responsibilities of the Commission is to identify patients and clinicians that will be involved in this EU HTAi. And my role is actually to identify these experts. So we have different means to identify them. I will not go into too much details. Maybe we can touch upon this later on. So I identify these patients and clinicians, and we also support them throughout the process. We facilitate their input in the joint work. And also previously I was involved, I had the chance to work with Valentina at CPF, also working on the EU HTAi regulation and all the advocacy around the implementing acts that were the implementing legislation after the EU HTAi regulation was adopted. So voilà, in a nutshell, my experience with patient involvement in HTAi.
Thank you. And Laurie?
So I first heard about HTAi in 2018, I believe. It was in a conference like this with other patient advocates, and I learned that national patient groups could do something in relation to HTAi. So I went back to our president at the time and I said, I think we should get involved in this. And I found some training opportunities, and since then our national organization has contributed to the national HTAi process in France several times. And I have also been following developments with EU HTAi. I was involved in some stakeholder meetings. I actually read the implementing acts. And we have, been preparing to participate as well on the European level, but there's also the national level of the European level. And I'm quite passionate about it. I like to talk to patient advocates in other disease areas in France to share our experience, particularly at what I know about how it works at the EU HTAi level now that we actually have a real process. And I will turn it over to Laura.
Oh, I've got a borrowed chair, borrowed mic. So I knew about this this panel when my slide came up and showed that I needed to be on the stage. My experience with HTAi started as a country that doesn't have formalized HTAi, and realized that there were a lot of decisions being made that we didn't understand the value of those decisions and what we were deciding on, and have worked tirelessly to look at increasing that and advocating at a policy level as we start developing HTAi and formalizing HTAi in our country, making sure that the patient voice has been heard. And I'm proud to say that after the patient voice being ignored, they've actually invited us to speak at the first National HTAi Summit that'll be held next week, Tuesday. So it would be the first time that they've acknowledged that patients need to be included into that HTAi process.
Thank you very much. And I want to say for France, it's amazing to see how the processes in France have developed in quite a short time to be now legally manifested, that patients sit in the committees. And for Lauren, I had the opportunity to personally see how much you engage in this area, which is really impressive. I would like to open the discussion to the audience. If you have questions, point up. If online, if you have questions, I don't know how they come to me, but they will come to me, I hope. There is one.
Hi, I'm really interested in seeing what your experience has been since the new HTAi.
Can you go a bit?
Sorry.
Yeah.
I'm really interested to see from patient perspective what you've actually seen since the new EU HTAi, the kind of revision has happened. Have you seen differences? What are the changes that you'd probably highlight?
Not really yet. It's a little hard to. What has really changed is the way that we're planning in our national organization and thinking about the future. You have to, because currently the only medications concerned by the new EU legislations are ones that have absolutely no approved indication in Europe. So the ones that are still in the old system, it's the same. There's no change. The ones in the new system, there is a process at two different levels, at the national level for defining PICOs and also at the European consolidated level. But there are other smaller things. So really the most important thing, what I would say about it as a patient organization, the most important thing to do is to ensure you have some trained people within your organization who know what it is, PICOs and some basic things. Because as Anke explained, there's many different levels of patient involvement. But the ones that I am familiar with now that are new, that are coming up, and it happened quite quickly that we were asked to provide a pool of persons to be registered in a database to say these are the people we can call on when there is some kind of need to involve these people. So you have to be ready with those people, and that's the most important thing I could say from the patient perspective.
Yeah, before I give the word to Valentina to react to that too, I just want to explain what PICOs are. PICOs are very important in the beginning of the process when the HTAi for a technology starts, and it's basically for defining the research questions. And PICO stands for Patients Intervention. So who are the patients? What is the intervention? What is the comparator we want to use in our research? And what is the outcomes we are interested in? And to do this, the Central European HTAi process basically needs to get input from all member states on what these things are they want to know. And that's where patients can already in an early stage be involved in the countries. Okay, so I give the word to Valentina.
Thank you. I can say on the European level, what we see is that there is a more systematic invitation for patients to participate in HTAi. So we constantly receive invitations to identify profiles. Julie knows that very well. And at least we have also a well-established channel of communications with the HTAi Secretariat and other stakeholders. Because, I mean, as Anke said, HTAi is a multi-stakeholder effort. So it cannot work if it is well organized only on one side. It has to be well organized on all sides. And otherwise, there is a risk of getting bottlenecks. And so what we are really trying to do is to remove the bottlenecks and keep those channels of communications as wide open as possible to be able to exchange information as far as it is possible, of course, because then there is also an issue with confidentiality of information. So while we comply with that, we need to make sure that there is a good understanding from all sides. And I think this is working quite well, which was not evident a few years ago.
Thank you. Julie, do you want to quickly respond maybe to also Laurie's remark that she doesn't see a lot of change yet?
Yes, thanks a lot for the question, and yeah, your comments always much appreciated to have feedback. I think it's a bit too soon to see results and changes because we are at the start of a process. The regulation applies from January. We had the first products coming up in March, so we didn't even finish one joint clinical assessment because these take months, years. So this is a bit too I think too soon to say that we see changes, but what maybe we see internally is how we have now, yes, this systematic involvement of experts, so patients and clinicians, and this is here a learning curve because we started the process, we are building the process, and we are very grateful to have very active patient organizations like EPF, part of this working group we set up to co-create the process, also to help us identifying patients, and also clinicians with clinical organizations, because we have certain, we are bound by the implementing legislation on how we can identify patients. So we need to go through the organization of a stakeholder network. But in a nutshell, just to say that it's the start of a process and we are moving towards improving it. We ask for feedback to the organization on what we can do better. We heard like the need of better communication. I also suppose that communication outside and raising awareness of the HTAi regulation will also have an impact on the changes we will see, because let's be honest, not many people have heard of what HTAi is. I'm quite surprised that in the room you all know what HTAi is, because usually this is not the case. So this is a learning curve, and we are building the process together. So I hope that if we reconvene at some point, we can see concrete changes in the process.
Yeah, and I agree with the learning curve. It's very important, and there I see the big opportunity in the European process, because it's mandatory, at least on the central level, and that will raise the quality across the European countries, because there were several countries which were extremely resistant to patient involvement, and now they are kind of faced with the reality. If there is another question from Wisdom.
Thank you so much. Wisdom from Malawi. I would like to probably should say lobby or comment on this. As much as we are talking of something that is big, as well as something that is quite interesting, as an institution joining this forum, as a member institution, our interest is also to save the community that we represent in Africa as well as Malawi in general. How would this HTAi be part and parcel of Malawi's growth in terms of health system? When you look at our health system in Malawi, it's more 80% of it's supported by donor. And looking at the opportunities that are around, but also the entire member, I think Malawi could benefit through one community. My question is, what would be the most appropriate stage for us to take along to be part and parcel of this process? Thank you so much.
I'll give that question to Lauren, because you are kind of hammering.
I think it's a few things. The first thing for you, Wisdom, and your organization is to be educated and to capacity build yourself so that you understand and know about health technology. You don't have to be an expert in health technology, but you have to understand what is needed in the process and what you can contribute and how you need to train patients to take part in the process. The second thing is about advocacy that we talked about yesterday. And especially in resource-constrained areas, decisions like this are good decisions and good things to do because they give us a reason for why we're making that decision. It backs up the reason, and we can see if we're making a good decision or a decision that maybe is not so good. I also think, when it comes to countries like ours that have donor funding, often we are taken and we make decisions on what's available as donor funding. We're not dictating what we want. So we're taking what's given, but we're not dictating what we want as a country and what our country needs. So this is an opportunity to sit in front of a donor and say, we've done the work, we've looked at the value, and this is actually what we need, not what you're proposing. So it's a scientific way or a processed, methodology-driven way for us to have backing of the decisions we've made and the things that we're bringing forward into policy.
Yeah, and I know from some other African countries where patients really have achieved major impact, not so much in terms of HTAi, because there is no HTAi, but using the same arguments you would use in HTAi to push their government to move forward with the health system, basically. Any other question? Alex?
So my question is probably towards Valentina and Julie, perhaps. So we had already some interest requests for joint scientific consultations as well. And one challenge that I've already sort of realized is that the conflict of interest forum has been the most comprehensive that I've seen so far for patient engagement. And the challenge that I saw with that, at least in our community, we have relatively small pool of patients that we can draw from, whom we usually train up to become advocates, and the forum is one of the places where they do that. So, and these patients then become advocates within their own organizations and ours too, where there is some connection to industry, which is then disqualifies them from being able to participate. So I wonder at EPF if you had run into this challenge already more broadly, because you had more areas to cover. And Julie, you've mentioned also the feedback mechanisms and trying to improve as you go along. So I wonder, I'm just, from your experience so far, how has that been managed?
Yeah, thank you for the question. It's, I think, it's the key question, because we have identified conflict of interest as the main barrier to patient involvement in HTAi, and we have been advocating for years to try to mitigate that risk and to get the HTAi community also to come with a more granular interpretation of this principle. Also because it cannot be black and white. You need to really assess what generates a conflict, and it's not just about the perception of a potential conflict. But right now, the approach is still quite strict. Officially, it's quite strict. But we are learning on the go how we can mitigate that risk. So indeed, it's about educating the community, identifying relevant profiles in advance, and try to somehow keep those profiles as free as possible from potential conflicts. And what we have been trying, also advocating with patient organizations, to try to build some profiles that could contribute in the early stages of medicine and development that can therefore collaborate with technology developers and companies, and others that can contribute to HTAi. Of course, if you keep all these skills in one profile, of course you will have a very knowledgeable profiles, but you always need to find a fair balance. And knowledge is very important, expertise is very important, but often, especially when it comes to the joint clinical assessments, they will ask for the lived experience. So they don't want you to be clinical experts. They want you to share what is your lived experience with living with the disease. So in that sense, maybe we don't really need to bring the profiles who know it all, but the profiles who can bring a genuine lived experience. Sometimes it's even better, I believe. But still, conflict of interest is a major issue, especially for small organizations that also where the patient community live with a degenerative condition. We know that it's extremely difficult to identify profiles. So we need to really build these pools of patients ahead as far as we can. Then I'm a personal advocate for differentiating the level of acceptability and tolerability of conflict of interest when it comes to a joint scientific consultation and a joint clinical assessment. I say that one profile doesn't fit all needs. So we need also the HTAi Secretariat and the coordination group to understand that they need to indicate also some nuances that are acceptable for them. So it's not a very easy exercise, but I hope we will get there.
Did you want to comment on that maybe quickly? So we have
Yes, just quickly, thanks a lot for the question. And before I explain how we integrated the feedback received, I just wanted to give a few insights. So first, the conflict of interest rules that we're all talking about is the result of a compromise between member states, also after consultation of stakeholders. And we have these rules in place to ensure that member states trust the reporting that it's of high integrity, of high quality, so that they can integrate and take into account the report at national level. Having said that, I think there's also a lot of confusion about the conflict of interest rules, because it's not that if you have an interest that you cannot participate in a joint clinical assessment or in a joint scientific consultations. You have different types of interests, and for instance, you have interests that will lead to exclusion from the joint work if you currently hold an executive position inside a pharma company, for instance. But you also have interests that will lead to limitations. If you receive, for instance, if you received payment from a health technology developer for a conference, it means that you will not be able to participate in the joint work of that specific health technology developer, but you will be able to be involved in another procedure. So having an interest doesn't mean that you will completely be excluded from the joint work. The Implementing Act is detailing all of this, and we are aware that this is quite complicated to understand, and after the feedback received from the different organizations, we are working on having a website page on the Europa website, also with a form where you can quickly identify the different interests and the limitations or the exclusion attached to it. Because we want to avoid having patients or clinicians filling the declaration of interest form, which is quite tricky, I understand, and I'm aware, and then they are excluded included. So this is also, we're trying to raise awareness of this and to improve moving forward.
Thank you, Julie. That's important. And I want to re-emphasize one word Julie said there, trust. I think it's really important that we create this trust because there are many stakeholders from the HTAi side who say like, oh, patient input, it's usually the same as industry said. And we know it is not like that, but we need to create this trust. So in the beginning, maybe we need a bit stricter rules, and then we can build on that over time, hopefully. So we are coming to the end of the session. I know you're all waiting for lunch. Maybe we do a very quick round. It's like, what's your view on the future of this? Where are we going from here? You started last time, so Lauren, maybe you can start. You have something coming up next week.
Yeah, I think for organizations or groups that are in regions like myself, I think it's great to see the formalization and seeing that, because it's in Europe, because we can use some of it, and it can be a template for perhaps what we can do. Whether it's perfect or not remains to be seen, but it's always good to see someone else's mistakes and then learn from their mistakes. So we're very thankful for that.
Speaking from the level of the coalition, I think that the future is really in facilitating gathering real-world data about patient experience. And this kind of ties in with the question we had from Wisdom in Mawali, because this data will be international and global that we are collecting, and it can be used for many purposes, including HTAi in Europe, for those of us in Europe, but it could also be used for other advocacy needs. So I really think this is a focus we have to use, because we face challenges now. There's a great new treatment. There is some presentation of results from a phase 3 trial somewhere in the world. And then, a few months down the line, you get your regulator asking you to provide a contribution. So you want to talk to patients in your community who maybe were included in this clinical trial, but it's very challenging to find them and to speak to those patients and get information about their experience, their lived experience, which is really what we want to hear. So when we have, maybe 2 people in Canada and 1 person in France and 3 people in Germany, we need to, as a coalition, facilitate the collection of that data about patient experience, and I think it's the way forward for us.
As I said, we're at the beginning of a process, and if we look at the future, I think we would need your active engagement and continuous support to first identify patients to be able to participate in the EU HTAi, but also to raise awareness of this regulation, because this is not very well known, and the impact at the national level and on patients is quite huge, so will be quite huge as we are at the start of a process. So in a nutshell, we would need your continuous active support.
A lot has been said already. I fully agree that in the future I would expect to see much more use of real-world evidence and relying on methods that allow the collection of a very diverse data set. And on the other side, maybe a call also to this community that is not only European. There is an opportunity for patients from other communities beyond Europe that could take advantage from this effort, because, of course, there is a formalization of the system, but also those JCA reports. Once they will be available, you can use them also in your context, in your countries. And if there are technologies, indications that prove some value, eventually you can use them for your advocacy efforts in your countries as well. So those reports will be available, hopefully will be translated in all European languages. So ideally with English, French, you should be able to, Spanish, you should be able to work with them. And they will be for use by anyone. So it's not only within the European context. And maybe that's, I think, an advocacy tool that we should emphasize a bit more.
Very nice point. Thank you very much. Thank you very much to the panel and to the audience. I hope this was stimulating and made you really, really hungry for the lunch that is coming, but also for HTAi. Before I let you go, I want to do a little bit of self-advertisement. This is where you can find information. You can go to the PCIG websites, and I think you get the slides afterwards. There are links. But on the right side, there is a book, Patient Involvement in Health Technology Assessment, that was published in 2017. And the good news is the second edition, of which I'm a co-editor, a very proud co-editor, will be released later this year, and it will be open access. So I will share the link with the Secretariat so that they can distribute it in this audience. With that, thank you very much, and have a nice lunch.